Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
The patient is short of breath, they're wheezing, they're struggling to finish a sentence. Somebody reaches into their bag and hands you a blue inhaler. Well, what is it? How does it work? And when should we use it? Today we're talking about Salbutamol, delivered in a pressure-metered dose inhaler, or pMDI. Pretty much that's the blue puffer. Salbutamol is a medication used to relieve bronchospasm, which is a narrowing of the airway that occurs in a condition such as asthma or some chronic respiratory diseases. Now, the medication belongs to a group of drugs called bronchodilators. It works by relaxing the smooth muscles surrounding the airways, allowing them to relax, therefore opening and making it easier to breathe. Salbutamol is most commonly supplied as a pressure-metered dose inhaler, puffer. Each activation, or puff, delivers a metered dose of that medication. It may be administered directly from the inhaler or used with a spacer device. The recommendation is that you use a spacer device because the medication is atomized within that spacer and inhaled over multiple breaths. After inhalation, Salbutamol usually takes a few minutes to work. Well, when do we use it? Asthma, wheeze, bronchospasm, shortness of breath associated with reversible airway narrowing. In a first aid context, it is administered to patients experiencing an asthma attack. The Australian Resuscitation Council approved treatment is the 4x4 method. It's 4 separate puffs of the metered dose inhaler into a spacer with 4 breaths taken in and out after each puff. And then this is repeated every 4 minutes until the patient recovers or while waiting for medical assistance. Now, some patients may experience side effects such as the shakes, increased heart rate, feeling a bit shaky, anxious, or even in some cases, mild headache. These effects, though, are usually temporary and less concerning than the potentially life-threatening asthma attack they're experiencing. It's also important to remember that not every patient with breathing difficulties is having an asthma attack. Anaphylaxis, heart conditions, and many other illnesses can cause similar symptoms. And remember, if a patient with a known food, insect, or medication allergy suddenly develops breathing difficulties, adrenaline should be given first if anaphylaxis is suspected. Remember, Salbutamol helps open the airways, but it's in the lungs, the bronchial tubes. As always, treat the patient, not just the symptom, because when somebody can't breathe, every breath matters.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.